Hi Nikhil. I can't tell you how excited I am. I always thought of making a podcast with you, and I just can't believe that today is the day when I'm finally able to convince you to speak something at least. So okay, to start with, Nikhil, tell me something about yourself.
So, hi, I'm Dr. Nikhil Bahuguna. I'm a dentist by profession, and I call myself a very happy dentist, someone who's contented in what he does, who believes to serve people with all his heart, do right work, do ethical work, and make sure that everyone who comes to you is given the right option, if not the right opinion. So, that's me. That's me for you all.
So, Dr. Nikhil, I believe you're a dentist, right? Now, other than dentistry, what is it that really excites you a lot?
Well, if you ask me what excites me other than dentistry is I love traveling, I love spending time with family and friends. And I totally believe if you have to feel happy, your excitement is derived from what gives you satisfaction. And what gives me satisfaction is quality time with people whom I love being around with. I mean, you could just probably plan a small trip or just a get together, meet them at home, take them out for maybe a couple of drinks, spend some quality time, talk to them, most importantly, listen to them. And that is what gives me a lot of excitement, more so peace, and makes me a very happy soul throughout the working environment that I live in.
Okay, that's nice. That's interesting. So, okay, Dr. Nikhil, initially, like how we used to follow you and we used to see that you used to travel a lot. A lot means, I mean, I don't think that even a single weekend you used to take off or used to be at home. So, it used to be either clinic or on the weekends you used to have workshops or you were traveling because of some conferences. So, well, I do see a dip over the past few years. So, what do you have to talk about the pre-COVID and the post-COVID times? How has that changed, this entire thing of traveling, work, conferences, other things apart from the routine clinical work?
Yes, sir, I enjoy a lot of travel because I love sharing whatever little I know with my colleagues. And that also gives me a lot of learning because when a question is asked, I do learn a lot from there. I used to travel a lot. I still do a lot of travel, but pre-COVID and post-COVID, yes, initially post-COVID things changed a bit because there was a lot of limited interaction that was allowed. But once things started easing out and started getting better, we were thinking that we will go back to the pre-COVID mode where we were traveling and working a lot. But then I realized during those 2 years when I spent a lot of time at home and there was not too much that one could do, I realized that what I was doing was nice. But now that I'm spending more time at home, I feel rather more comfortable. So I do travel, yes, a lot these days, but I plan it such that I try to come back home as soon as I can. If it's a weekend program, I'll make sure that by Sunday evening I'm home, or if I leave on a Sunday morning, maybe latest Monday morning I'm home. Because what changed pre and post COVID was the time we spent with our closed ones, which I realized is the most important thing. Because you may cut down a little on work, you may feel that it's going to affect you drastically, but what you want is a happy life. Money at the end of the day is a byproduct of what you do, so it will still keep on coming. But if you're peaceful and happy, you're contented in what you do, you always make a more happier person.
Okay, nice. Also, like during COVID, I remember, dentist was the last person where the patients were, thinking to come for the dental treatment because we know that, how much distance was important during COVID. And when it comes to dentistry, that was something which was at the last priority when it came to patients. Now, down 4-5 years down, post COVID, do you think the kind of patients you used to get before, or the dentistry is back to what it used to be before, or you still feel that there is a dip and people are still not very comfortable or anything? What is your take on that?
See, when COVID happened, I would rather say it was something which was, see, good is not the right word, but it benefited a lot of healthcare in a manner that the lapses that were previously ignored by a lot of people in terms of sterilization, etc. COVID made sure everyone follows those norms. So basic norms of hygiene, sterilization, spacing between two appointments, distancing patients, everything became a norm. And once people started with that, I guess it did help them to channelize their practices towards a more cleaner, more sterile environment. The numbers, yes, dipped a little post-COVID because everyone was scared. There was a lot of misinformation also spread along dentists that if you go there, aerosols will contaminate you and you can contract COVID the fastest, which was not true. But yes, when you take simple measures, things were better. If I tell you my story, we started working about 6 months after the entire thing was done, and we did manage our practice such that we're not seeing more than two patients in a day, as in one room has one patient, the other has the other, and then we started sanitizing the entire place regularly, and patients used to notice that. So yes, the numbers became lesser, but the frequency was still the same. And slowly, when this entire thing became a habit, even we realized how we can most effectively incorporate all these things in our practice. The numbers started coming back. The faith of the patients was still there with us, and all what we did, what they could see, made them even more reassured that we are concerned about their health. And yes, now things are quite back to normal, but with a good way that whatever we were practicing during the COVID times, we made a point that none of those measures are stopped, and everything is being done as exactly that we practiced in a full sterile manner during the COVID time. Even previously, our sterilization protocols were as per the rules, but now we made special and extra efforts to make sure everyone who comes in gets the highest care of quality.
Okay, great. So Dr. Nikhil, this is one aspect wherein, okay, you spoke about sterilization and everything. Now, as far as I remember, there were a lot of people who did have some kind of mental issues during this period because, people were home, they were out of work and stuff. And the way you explained about the neuromuscular disorders when it comes to your jaws and how the pain in the jaw is related to some other body part. We will talk about all that stuff in our next podcast. Okay, so how all these things are linked in the body, okay, and it also has to do with mental well-being. So stay tuned for our next podcast where we will talk about the link between the neuromuscular issues and dentistry. Thank you so much. Thank you, Dr. Nikhil.
Thank you very much. I hope we connect soon.
Sure.